S.K. Wangnoo, currently working as senior consultant in the Department of Endocrinology and Metabolism at the prestigious Indraprastha Apollo Hospital, New Delhi. I'm going to talk about the early and the goal-based treatment of the lipid abnormalities or the dyslipidemia in patients with diabetes. Indians are unique in the sense that the diabetes occurred 10 to 15 years earlier as compared to the Western population, number one. And the typical abnormal lipid profile in Indian scenario is elevated triglyceride, low HDL, and the high LDL, which is small, dense LDL particle. Apart from that, we have seen that Indians get heart disease at a young age, and the subclinical atherosclerosis is prevalent mainly even at the time of diagnosis and also in stage what we call the pre-diabetes. The Lipid Association of India has recently come up with the goals of keeping the LDL as low as possible in all the diabetic patients. So it is our duty to start the statins right from the day one when the patient is diagnosed to be having diabetes. And as per the different categories, the risk categories of the diabetic patient, which is based on the other cardiac risk factor and the presence of heart disease, the goal of the LDL changes. The minimum goal, which has to be kept in patients who have got established atherosclerotic cardiovascular disease, to be kept even below 50 milligram per DL as per the recent guidelines. And this is important that the statins are the mainstay of the treatment to reduce the LDL to a desirable level. And the choice of statin matters. There have been a lot of clinical trials with the use of rosuvastatin, which Jupiter trial and the Uranus trial has shown us emphatically that rosuvastatin is better than the atorvastatin in reducing the LDL goal. And also the originator or the innovator of the molecules, the use of those statins are important as compared to the biosimilars or the generic, because there are a lot of impurities in the generic which makes its efficacy less as compared to the innovator. So the rosuvastatin is the preferred drug of choice for reduction of the LDL cholesterol. It is more potent and its dose is half the dose of atorvastatin. If you are using atorvastatin 80 milligram, you have to use rosuvastatin only 40 milligram. Because of its potency and reduction of the high sensitive CRP, the choice of statin remains rosuvastatin, and that too of the originator, which is from the company called AstraZeneca. All the diabetic patients should be taught that statin is the mainstay for the cardiac protection, and they have to remain on goal of LDL below 50 throughout their life in order to prevent the ongoing long-term cardiovascular complications. Because the death in diabetic patients is mainly because of the cardiovascular complication, and we have to prevent it by maintaining the LDL goal of less than 50. And in some circumstances, in very high risk patients, we have to even go as low as below 30 milligram of LDL in certain patients. So with this, I invite all my colleagues and friends to attend the ongoing RSSDI between 11 to 13. And you heard a lot of specialists talking on the different topics of diabetes. And it will be very useful, scientific extravaganza for you. Thank you very much.